We're going to be talking about smoking and vaping and the impact on the voice. The bottom line is don't smoke anything ever. Some people will say there are certain things that you can smoke that won't affect you as much. Really, the lungs are not designed to take anything except air, and they can tolerate some water vapor, purely water vapor. But anything else that you put into the lungs is usually going to cause irritation. If you can, try to avoid being around smoke as well. People are usually pretty aware of the health risks associated with smoking, including the link to several types of cancers, including lung, throat, mouth, pancreatic, and bladder cancer. There's also an increased risk of heart attack, strokes, lung disease, and emphysema. But people are often less aware of the effect on vocal health and its linked to vocal injuries. Smoking is known to significantly change the characteristics of the voice, often causing it to become hoarse over time. It typically causes irritation and dryness, and it often will become deeper over a long period of time. It makes the voice quicker to fatigue, it decreases lung function, which of course is the power of the vocal instrument, and it increases risks for injuries, including vocal hemorrhage, vocal polyps, and nodules. We've looked at a number of diagrams of the vocal folds, but I'm actually going to now show you a couple images of vocal folds. So if you're a little bit squeamish, then you may want to close your eyes or skip to a later part in the video. So this is an image of a really healthy pair of vocal folds. You can tell that they're healthy because they're super smooth on the sides and there's no bumps or ridges on them, and the tissue doesn't look inflamed. Now I'm going to show you a picture of a condition called Reinke's edema, also known as smoker's polyps. 97% of people who have been diagnosed with Reinke's edema are habitual smokers, which is why they've also been dubbed smoker's polyps. So what happens is that the chemicals in the cigarettes cause fluid to actually leak through the membrane walls. It strips the tissues of necessary proteins, and it results in hoarseness, a significant reduction of vocal range, and sometimes even difficulty breathing, which I would probably argue is present in this particular case. You can see that the polyps are actually obstructing a good part of the airway. There are a few occasions where this condition can be the result of reflux, but much more often it is present in smokers. Now, in recent years, a lot of people have turned to e-cigarettes as a supposed risk-free alternative to smoking. However, as we mentioned, it's important to understand that whatever you put into your lungs that is not air or maybe pure water vapor is not really supposed to be there. Of course, the vapor that's found in e-cigarettes is not just water vapor, it's water vapor with a lot of added chemicals in them. Now, because e-cigarettes are a relatively new product, there are obviously no lifelong case studies where we can determine lifelong outcomes. But there are a number of studies emerging that are showing that vaping has not only significant risks to a person's voice, but also risks possibly to their overall health. Here's what you should know about e-cigarettes and vaping. Vape pens, mods, tanks, and Juuls all fall under the category of e-cigarettes. Juul is a brand that's pretty popular among young people, many of which probably don't know that one Juul pod has the same amount of nicotine as about a pack of cigarettes. Nicotine is known to be quite harmful to the teenage brain. It affects attention, learning, and impulse control. Before we get into specific additional chemicals that are found in most e-cigarette products, it's important to understand that most of these products function at high heat. We talked about this in the steaming video, but anything that you inhale at high heat is going to swell the vocal folds. So baseline, just the temperature of the product is already going to put the voice at higher risk of injury, because singing or talking on swollen vocal folds is usually not a good idea. So there are a few different health and vocal injuries that scientists are starting to see emerge from the use of e-cigarettes. One of the most common is irritation and laryngeal inflammation caused by irritants in the vapors. Nicotine is one of these irritating chemicals, but another one is propylene glycol, which is a primary ingredient in most vaping products, which causes dryness and irritation. Diacetyl is a compound that is commonly used for flavoring, and that also causes irritation. And as we've talked about, irritation and swelling increases the risk of vocal injury, including hemorrhages, polyps, nodules, and other conditions. The CDC also warns about links to lung damage and a condition called EVALI, which is e-cigarette or vaping-associated lung injury. A common compound that is found in many people who develop EVALI is vitamin E acetate. Now, vitamin E is very common in foods and different supplements, and it's not harmful when it's ingested through the mouth. However, scientists are discovering that as a common ingredient in many e-cigarette products, when vitamin E acetate is inhaled into the lungs, it may interfere with normal lung function. Studies are also showing that the chemicals in e-cigarettes actually lead to an erosion of epithelium and alter the fatty acid balance in the membranes of cells. So these chemicals are actually affecting the body at a cellular level. Finally, scientists are exploring whether vaping can lead to chronic obstructive lung disease, also known as COPD, which is a really common condition in smokers. We do know that e-cigarette users are twice as likely to develop COPD as non-e-cigarette users, although there is not enough evidence yet to determine if there is a firm link between that condition and vaping. In the next video, we're going to be talking about vocal misuse and vocal overuse, which is probably the biggest cause of vocal injury and vocal problems. Until next time, see you later.